I want to begin by thanking you for your commitment in volunteering to improve patient safety through the implementation of Bedside Report. The purpose of this educational module is to provide you with information about nurse-to-nurse bedside handoff and hopefully serve as a guide to help you implement it at the bedside. So what is Shift Report? Back to basics. Shift Report is a system of nurse-to-nurse communication between shift changes intended to transfer essential information for the safe and holistic care of patients. Literature has shown that shift report is a very critical time in which accountability and responsibility are transferred from one healthcare professional to another. There is even existing research that likens patient handoff among nurses to the handoff at the Space Shuttle mission control, settings with high consequences for safety, risk, and failure. So as nurses, it's important for us to be constantly evaluating and improving our communication techniques. Traditional methods of report include verbal, note-taking, phone recording, and tape recording. However, through these conventional methods of report, healthcare professionals often fail to involve the patient in their plan of care, which is essential as healthcare shifts towards a more patient-focused perspective. There is always a struggle between ensuring a comprehensive handover and then avoiding time or information overload. In addition, the variability in which handoff report is given is also a time in which critical information can be missed or cluttered with irrelevant information, resulting in medical errors. With handoff, if done poorly, it can waste time and even jeopardize patient safety. In 2007, the Institute of Medicine and JCO found that 80% of serious preventable adverse events were due to errors in handoff communication. So in response, JCO developed the National Patient Safety Goals. They include improvement in the accuracy of patient identification, improvement in the effectiveness of communication, particularly in managing handoff communication, and encouragement of patients' active involvement in their own care. So what is Bedside Report? Bedside Report, or handoff, is a process in which the oncoming nurse and outgoing nurse meet at the patient's bedside to discuss their medical status, plan of care, and progress towards care goals. More specifically, it's the communication of important patient information between shift changes designed to transfer vital information for safe care of the patient that occurs in the presence of the patient. So why the big change? We're basically shifting report from the nurse's station to the bedside, and it's quickly becoming a national trend as it centers on the patient, and it's also a huge patient safety initiative. What are the advantages for the patient? For the patient, it promotes patient safety and accurate patient identification. For patients who are nonverbal or confused, it allows two nurses to go in and verify the patient with a patient identifier. For patients who are alert and oriented, it allows and promotes for active patient involvement. Literature review supports evidence that patients have better health outcomes when patients actively participate in their plan of care. We basically place the patient at the center of his or her own care decisions, which increases patient compliance and thereby increasing patient satisfaction. Another advantage is that it's also been proven to decrease call light usage, which can serve as a benefit for the nurse as well. For the nurse, it improves the rapport between our patients, thereby improving the nurse-patient relationship. It eliminates the blame game and the idea that nurses lack communication among each other. Since the patient is present and witnessing us giving report, it demonstrates teamwork while showing patients a side of nursing that they've never seen before. It also eliminates any anecdotal or irrelevant information you oftentimes get in report. Report is sometimes cluttered with information about the patient's family or doctor, information that is not pertinent to take care of the patient. It also allows for a brief assessment of the patient. You can visualize your patient and get a baseline assessment before even starting your shift. It encourages nurses' ownership, accountability, and teamwork. There are also less interruptions at the bedside. Our current methods of report usually take place at the nurse's station, where it's oftentimes very chaotic, with family members calling, doctors wanting to speak with us, phone calls. There's less interruptions at the bedside with the patient. You can also quickly encounter problems with the patient at the bedside. There's also less litigation, and you're better able to answer providers' questions. So, how to be successful in implementing bedside report? While this educational module is not designed to implement it at the bedside and trial it as a pilot project, it's this investigator's recommendations to implement it at a future time. Patient education regarding bedside report will be given to clients. Report will take place between 7 a.m. to 8 a.m. and 7 p.m. to 8 p.m. every day. We ask that family members and visitors step outside of the room to maintain privacy. And we want to ensure the patient that their confidentiality will be maintained. A common question or concern that comes up with bedside report is this a HIPAA violation? And no, it is not a HIPAA violation. These conversations and questions take place every day at the nurse's station and even at the bedside. The providing team usually does rounds with the patient and discusses their medical history and the plan of care, and this is very similar to that. So this is where 6 a.m. and 6 p.m. rounds become very, very important. We want to minimize interruptions by letting the client know that we have a short amount of time to give report. Is there anything we can do to help to minimize interruptions, such as assisting them to the bathroom or giving them pain medications? So what are the off-going nurse's responsibilities? As the two nurses enter the room, it is the off-going nurse's responsibility to introduce the oncoming nurse. The off-going nurse should also review the plan of care, the admission date, treatment team, diagnosis, relevant history, code status, allergies, isolation, and impairments. Next, we want to go over their problem list. Here, we want to report by exception, similar to charting by exception, by only focusing on the patient's problems. We want to review their stability, neurological status, respiratory, cardiac, peripheral IV site, maintenance fluids, pain management, skin condition, mobility, ambulation, GI, GU, wounds, and other information. The off-going nurse should also review changes in the plan of care, interventions that were or were not successful, changes in medications, new orders, discharge plan, and any patient education needs. We want to be thorough but concise with report. We don't want to include any lengthy or rambling comments, speculative material, irrelevant or outdated information, a description of nursing activities unrelated to the patient's care, or any inappropriate comments about the patient's family or doctor. What are the oncoming nurse's responsibilities? The oncoming nurse should briefly look at the patient's IV lines, drains, and dressings as the off-going nurse is reporting. We also want to update the communication board and allow the patient to discuss concerns or questions. So what are some common concerns about bedside report? What about sensitive information like new test results? Sensitive information, information that the patient is unaware of, or information that the provider has not yet disclosed, will not be shared at the bedside. We want to share with the oncoming nurse outside of the room, either at the nurse's station or in a private area. And what about family, friends, and visitors? We want to discuss the patient's preference beforehand. Let them know that information regarding their medical history will be discussed, and then respect their decision. And won't this take longer than traditional report? Research has shown that it actually takes less than or equal to the same amount of time as traditional report. And lastly, what if the providing team is rounding on the patient during handoff? You're more than welcome to join in. This next slide shows a YouTube video example of bedside report and shows you as the two nurses are discussing the patient's medical history and plan of care. If you have questions, I'd be more than happy to answer them. And again, I want to